My name is Sunheng Lee, and as a part of this course, I'll be presenting 3 literature reviews today. Here's the list of literatures. First one's called Molar Augmentation with Pedicle Buccal Fat Pad in Orthokinetic Surgery, 3-Dimensional Evaluation. Second one is called Aesthetics of the Nasal Dorsum, Proportions, Light, and Shadow. And the third one is called Anthropometric Analysis of Linear Parameters of the Indian Nose, a cross-sectional study and comparison with the literature. So the first study was published on the Journal of the Plastic and Reconstructive Surgery in 2015. The author is Dr. Federico Hernandez Alfaro, who is a professor of oral and surgical pathology and implantology at University of Catalonia. In introduction, the author tests that the surgical creation of beauty requires the attainment of a correct balance among the 3 major prominences of the facial skeletal anatomy, which are the nose, the molar midface, and the jawline regions. And according to the article, prominent molar regions are regarded as a sign of beauty and youth in Western societies, which is somewhat the opposite of the Eastern societies where people want to reduce the molar projection on their faces. There are several techniques that increases the volume in the molar region, but with potential complications such as rejection and infection of prosthetic implantation, need for the repeated injection of fillers, and etc. Through this article, the author suggests molar augmentation using pedicled buccal fat pad for improved results. The total number of 6 patients were evaluated for the study. They were referred to orthokinetic surgery and malarplasty and operated on under GA by the same surgeon. The subjective evaluation employed the visual analog scale of 10 for pain, 0 being painless, 10 being maximum intensity of pain. For satisfaction, 0 being complete dissatisfaction and 10 being the maximum satisfaction. For the objective evaluation, 2 parameters were used: complications and volumetric assessment using CBCT. Volumes were measured 3 times, pre-operative, 1 month, and 1 year after the surgery. These are the pre and the post-operative photos of the right 2/3 view of the patient case number 6. The post-operative photo presented here was at 1 year follow-up. And these photos show the procedures of the surgery using buccal fat pad. Through the limited buccal incision used for the Lefort 1 osteotomy, gentle dissection of the buccal fat pad was performed. A subperiosteal pocket was created over the interior and lateral aspects of the molar bone. At this point, a resorbable 3/0 suture with an atraumatic needle was used to take hold of the buccal fat pad. The free end of the suture was engaged into a straight needle. Subperiosteal progression of the latter followed for displacement of the buccal fat pad toward the uppermost and lateral areas of the pocket. After percutaneously recovering the needle, it was again led through the same entry port to re-engage the buccal fat pad subperiosteally. A subperiosteal pocket was created over the interior and lateral aspects. And here's the result. Subjectively, all of the patients were satisfied with the volume achieved at the molar area. The visual analog scale score for every satisfaction was 10, and none of them complained of pain. The visual analog scale score for the average pain was 1. Also, there was no surgical complications. For the objective volumetric assessment, the average amount of augmentation 1 month after this procedure was 124,586.32 cubic millimeters, and the median volume variation was 7.77%. The mean increase after 12 months was 119,008.77 cubic millimeters, and the median volume variation was 3.52%. Therefore, compared with the baseline volume, the final mean increase 1 year after surgery was 3,527.86 cubic millimeters. In conclusion, the article suggests The pedicle buccal fat pad transposition technique represents an excellent alternative for malar augmentation in patients in whom an orthognathic surgical procedure is expected. The standard Lupford 1 approach allows for easy dissection and upper repositioning of the buccal fat pad. The author thinks that the technique is associated with minimal morbidity and high patient satisfaction. But personally, I was curious about the direct comparisons between the pedicle buccal fat pad transposition and other malar augmentation methods. Also, for further research, seemed necessary to evaluate long-term results of the method. The second article is called Aesthetics of the Nasal Dorsum, Proportions, Light, and Shadow. The article was published in the Journal of Facial Plastic Surgery in 2017. The first author is Dr. Natalie Crane, and the corresponding author is Dr. Michael Kim, who is the faculty of the Department of Otolaryngology, Head and Neck Surgery at Oregon Health and Science University. The article is about assessing the aesthetics of the nasal dorsum and other factors to consider in the aesthetic analysis of the nasal dorsum, including ethnic differences. The article addresses that the nose has always played a central role in facial aesthetics due to its conspicuous location on the face. Over the long course of history, the accepted ideal appearances and proportions of the nose have changed. The recent preferences for more natural and less operative shape have led to a desire for a slim and straight nasal dorsum on the front view, and a profile view that exhibits slightly concavity in females and slight convexity in males. By assessing the aesthetics of the nasal dorsum through the use of lines and angles, one can more precisely elucidate a goal for the patient's postoperative nasal shape. The fundamental aesthetic lines and calculations employed in dorsal assessment include the paired dorsal aesthetic lines, the nasofrontal angle, and the nasofacial angle. First, the aesthetic lines. The nasal dorsum provides a thoroughfare between the radix and the lateral projections of the crura of the lower lateral cartilages, creating paired converging to diverging lines. These brow tip aesthetic lines follow a slight curve from the superior orbital rim at the medial brow, passing through the lateral radix and extending to the nasal tip defining points. The second tool is nasofrontal angle, which is calculated by comparing a line along the nasal dorsum to a line from a nasion to the glabella. This angle should approximate 115 to 135 degrees. The apex of this angle, the salion, is considered the nasal starting point at which the forehead appears to end and the nose begins. On profile view, this is normally located near the upper lid margins in Caucasians and near the mid-pupillary horizontal line in non-Caucasians. The next tool is the nasofacial angle, which is calculated by comparing the incline of the dorsum to a vertical line perpendicular to the Frankfurt horizontal plane, which is ideally approximate at 36 degrees. While the nasofacial angle defines nasal projection from the face, the nasofrontal angle may be referred to the nasal starting point. The tip projection can be measured by a variety of methods. The Crumley method involves forming a triangle with a vertical tangent between the nasion and alar facial sulcus, a perpendicular line from this tangent to the tip defining point, and a final dorsal line from the nasion to the tip defining point with a dimension ratio equal to 3 to 4 to 5. The Good method determines nasal projection as a percentage of the nasal length by drawing a vertical line from the nasion to the alar groove and a horizontal line from the alar groove to the tip. The relationship of the latter line to the former line is expressed as a ratio, ideally equaling 0.55 to 0.60. Finally, dorsal projection is defined by drawing a vertical line through the alar facial sulcus and describing the ideal height of the rhenion as 18 to 22 mm from this line and the ideal tip projection as 28 to 32 mm. In contrast to the established aesthetic lines and angles, Kekier et al. Describes the use of nasal geometric polygons for the aesthetic evaluation and development of operative goals in rhinoplasty. This is relatively a new approach. The authors of the method evaluate the nose through polygons and triangles to identify the inherent shadows and highlights related to anatomic structures. These geometric polygons include the glabella polygon, the dorsal bone polygon, the dorsal cartilage triangle, the lateral bone, upper lateral screws, facet, infralobular, columella, and foot plate polygons, and the dorsal cartilage, dome, and interdomal triangle. The dorsal aesthetic lines follow the lateral edges of the glabella polygon, the lateral bone polygons, and the dorsal bone polygon. Additionally, the authors describe the lateral aesthetic lines, which emphasizes the triangularity of the nose and prominence of the nose as compared to the cheek. Well, regardless of what approach is used to define the ideal dorsal contour, it is essential for the surgeon to have a clear picture in mind of what the postoperative contour goal is for each individual patient. Over-resection of dorsal hump will result in insignificant distortion in the proportion and aesthetic lines of the dorsum and can weaken the keystone area. Also, aggressive resection of the cartilaginous and or bony dorsum can result in saddle nose deformity, flattening of the midface. In terms of F10 considerations, in the past, many non-Caucasian patients saw changes corresponding to Western features, but currently there is a shift to enhance one's native ethnic features and not efface them. For example, the Asian patient may desire a higher dorsum, but care must be taken to not only overly elevate the nose in height, which is stated to not exceed the mid-pupil as the starting point. The methods described on this article shed new light on the established subject and provides yet another tool to analyze the nasal dorsum. These means of analysis together may help to supply consistent and reproducible techniques for aesthetic assessment and determination of post-operative goals. Despite the variety of analyzing tools for the ideal nasal dorsum, there is no clear consensus on the subject, and therefore the rules should only be used as guidelines, which means that it will be necessary to have thorough communication between provider and patient to ensure an alignment in aesthetic goals. And finally, this is our last literature that we're going to talk about. It is called Anthropometric Analysis of Linear Parameters of the Indian Nose, a cross-sectional study and comparison with literature. This article was published on the Journal of Plastic, Reconstructive, and Aesthetic Surgery in 2021. Because there's an anthropometric heterogeneity in different racial groups, the perception of beauty varies for each of them. As the human nose differs in anatomy and morphology between racial groups, it's become apparent to surgeons that most of these patients place great importance on maintaining their core ethnic features while achieving cosmetic enhancement. On the other hand, anthropometry is the science that defines physical measures of a person's size, form, and functional capacities, which varies from a racial group to another. The study aimed to perform detailed and dedicated external nasal anthropometric measurements using standard surface markings to find the differences between males and female subjects that could provide useful insights in the field of aesthetic rhinoplasty procedures. The article also compared the results with studies on North Americans, Koreans, Africans, and Chinese available in the literature. The study was designed as a cross-sectional hospital-based study with 500 subjects. The range of the age of patients was between 18 and 35 years old, and patients with a history of facial trauma or surgery, respiratory diseases, with BMI more than 27 or pregnancy were excluded from the study. Total 32 variables were measured for comparison. 21 of them were recorded in millimeter, 18 of them were direct, 3 of them were indirect. 11 proportional nasal facial indices were calculated. These photos show how surface marking was carried out on subjects. These schematic drawings indicate the surface landmarks of the nasal area. Mean values of all the linear measurements in our study were more in male than female subjects except olar width. All the measurements were found to be statistically significant between male and female subjects, except for parameters of olar width, columella length, intercanthal distance, and distance between nasal axis and columella. Of the 17 statistically significant variables, 14 variables were highly significant, p-value lower than 0.001. The proportional indices that were calculated also reveal statistically significant differences in 6 out of 11 measurements between our male and female subjects. In comparison with the data of female subjects with the study of Indian American female subjects, it showed significant differences in 12 parameters out of 14 compared. There were also significant differences in the results of most parameters when compared to the collected data with the North American white female population. Only parameters of nasal length, total nasal length, nasal height at the tip, and alar thickness were comparable with them. Only 3 parameters were comparable when comparison was done with Korean Americans. A study by Porter J.P. on African American noses also revealed the data statistically different from this study. Only 2 out of 15 parameters were comparable. In comparison with studies done on Chinese subjects, most of the parameters were significantly different. This is just the rest of the table. Proportional indices were also found to be statistically different in 3 out of 6 values when compared with the North American study, in 4 out of 6 in the African American study, and 2 out of 3 in the Chinese study. According to this article, Indian nasal index was higher than North Americans, but lower than Africans and Chinese. The values were statistically different from these races, even though some of the individual linear parameters were comparable. The columella length nasal tip protrusion index gives the proportion of columella length in relation to the nasal tip protrusion. The Indian nose was found to be in between the North American white nose and Korean nose in this study. Also, the total nasal length lower 2/3 face height index was found to be comparable with the Caucasians and Chinese. As mentioned previously, good method is used to measure tip projection. In this article, Indian males and females showed ratio of 0.6 and 0.62 respectively. The author states both male and female subjects showed underprojected noses according to Janice J.E.'s finding, which described the ratio should be 0.67. In conclusion, the Indian nose can be considered as a different entity in comparison to the North American white population, Africans, Koreans, and Chinese. The findings of the current study prove the importance of standardizing the measurements and proportional values for the Indian nose. Well, this should be the same for each ethnic group, which were excluded from the previous standards with samples from Western societies. This is the end of my presentation. We went through buccal fat pad transposition as molar augmentation method to enhance the mid-face region, and tools and guidelines to analyze nasal dorsum, and anthropometric measurements for the Indian nose. It is fascinating to see different cultures with unique characteristics and distinct definition of beauty. I hope we can discuss the subject in person soon. Thank you for your time.